Hey everyone, welcome back to my YouTube channel. My name is Chinon Sugit. Last week, we looked into who a sport therapist is. Today, I want to talk about the 5 competencies of sport therapy, which is actually sometimes known as the pillars of sport therapy. These skills are the very foundation of how sport therapists help athletes to stay at their peak, recover from injuries, and prevent new ones. So, whether you're an athlete or you're just curious about how sport therapy works, this video will give you some insights about sport therapy. So, let's jump right in. So, competency 1 is prevention. This pillar is a big part of a sport therapist's job. It's not just about treating injuries, but also stopping those injuries from happening in the first place. This means designing injury prevention programs, which could include warm-up routines, strength trainings, flexibility exercise, and even correcting movement patterns. Um, Sometimes movement patterns can actually lead to injury, and correcting them can actually prevent injuries from happening. For instance, if a runner comes in with signs of potential knee issues, the sport therapist might work on improving the running form, strengthening the muscles around the knee, and implementing a strategic stretching routine to prevent injuries. Competency 2, recognition and evaluation. This is where sport therapists use their expertise to quickly and accurately diagnose an injury or physical condition. They evaluate how an injury affects movement, pain levels, range of motion, and overall function. Let's say a footballer sprains an ankle during a game. The sport therapist needs to determine whether it's a mild strain or something more severe like a damaged ligament. The ability to recognize and evaluate this injury is critical to providing the right treatment and ensuring a safe return to play. Competency 3, management, treatment, and referral. So once the injury is assessed, the next is the management and treatment and possible referral of the athlete. A sport therapist will create a management plan, which could include manual therapy, exercise therapy, and sometimes even referral to other healthcare professionals like an orthopedic surgeon or even a physiotherapist. If the injury is severe, that's if the case in the case that the injury is severe. For example, a sprained wrist may need immediate treatment, which could include ice and rest, followed by manual therapy to improve the mobility of the wrist and some strength building exercises. If the injury is beyond scope, the athlete is therefore referred to a specialist. Competency 4. This is rehabilitation. The fourth pillar, which is rehabilitation. After treating the immediate injury, the therapist focuses on guiding the athlete through recovery. This often involves creating a personalized rehabilitation plan, combining strength training, flexibility exercise, and gradual progression to full activities. The goal is not only to recover from the injury, but to come back stronger than they were before. For instance, after an ACL injury or an ACL tear, a therapist might design a long-term rehab plan that starts with range of motion exercises and eventually progressing to more intense strength and agility training. This can actually help the athletes come back to play more stronger than they were before. So lastly, we have the education and professionalism. A great sport therapist doesn't just fix problems, they also teach athletes on how to care for their bodies and prevent future injuries. This includes educating patients on proper techniques, body mechanics, and recovery strategies. Professionalism also means staying up to date on the latest research and treatments to provide the best care possible. Whether it's advising an athlete on hydration strategies or demonstrating proper lifting techniques, education is key part of a sport therapist duty. So to recap, the 5 key competencies of a sport therapist are prevention, recognition and evaluation, management and treatment, rehabilitation, and education and professionalism. Together, these pillars make sport therapists an essential part of any athlete's team to help prevent injuries, provide top-notch treatment, and support athletes in their recovery and overall performance. Thank you for watching, and if you found this video helpful, make sure to like, subscribe, and hit the notification bell for more content on sport therapy and injury prevention. Drop a comment below if you have worked with a sport therapist or if you have any questions. See you in the next video.